Hi, my name is Robert. I'm a registered nurse, and today's presentation will be what to place on the envelope that's going to hold your loved one's medical history papers, things that you'd want paramedics and fire rescue to see instantly. Now, the envelope should be about the same size as a piece of typing paper. You could possibly get this locally online, but I would recommend to get one that doesn't already have any writing on the front or back of the envelope. Plus, I would recommend to write everything out first on a separate sheet of paper. This might take a few times to get the way you actually want it to look, but then afterward, transcribe it over so you're not wasting an envelope. To begin, paramedics and fire rescue have been teaching for quite some time the benefit of keeping your loved one's medical history papers inside or next to the refrigerator. The reason being is that if they had to go to your loved one's home, the easiest item to find in the home is a refrigerator. So you'd want to place a note on the refrigerator indicating that your loved one's medical history papers are located inside or next to it. But this isn't the only place a note should be placed. An additional note should be placed by the inside of the front door or where they would lead them out if they had to take them out by stretcher. You don't want to place the note on the back of the door, for that could be open if they have to leave now, but rather near where the light switch is usually located, where it can easily be seen. The idea is that if paramedics or fire rescue miss seeing the note the first time, hopefully they won't miss seeing the second time inside by the doorway. At the top of the envelope, centering in large text, simply write medical history. Underneath this, centering large text as well, write their full name. If they're a Mr., Miss, or Mrs., or use a different prefix, a choice may be to place this before their first name and following their last name, if relevant, such as senior, junior, third, or other known suffix, consider to place this as well. If they don't go by their surname, but rather a preferred name, say his name is Charles, but he goes by Charlie, or her name is Elizabeth, but she goes by Beth, or his name is Red because he goes, due to his red hair, you would want to include that. So underneath their name, you want to put in parentheses the word preferred name or nickname, whatever fits correctly, followed by a colon and the name chosen. Here are two examples. The reason you're including this is that if your loved one is nearly unresponsive, they might be more receptive to the name they're used to being called rather than their surname. This could possibly even build more trust by your loved one other medical staff taking care of them. The next part going downward, again matching along the line of where you started their name, is to place a current colorized picture of them, about half the size of a baseball card or a little bit more, say head to mid-chest, but not too close or too far away. To the right of that, you're going to draw a stick figure, the kind that you would see outside a restaurant bathroom, but one that represents their gender. This should be the same size as the colorized picture. Moving over next to the head of the stick figure, you're going to write either male or female, that which represents their gender, and under the word male or female, you're going to write the word height, followed by a colon, and underneath the word weight, followed by a colon. Those three should equal the same length and colorized picture size. It should be equal, they should be the same size. Next to the word height, you're going to write how tall they are. So let's say your loved one is about 5'4". So you're going to write the number 5, followed by the word foot, and then the number 4, followed by the word inches. I'm not big on using abbreviations. I wouldn't recommend using the quotation marks, like that could be misunderstood. But next to the number 5, you could write FT period to indicate foot, and next to the number 4, write IN period to indicate inches. If so desired, you can even write this in centimeters, which is roughly 162. So you'd write the number 162, the word centimeters, or the centimeter abbreviation, which is cm period. For weight, let's say they're 154 pounds. So you'd write the number 154, followed by the word pounds, or the abbreviation for pounds, which is lbs period. You could also write in kilograms, which is roughly 70. So you'd write the number 70, the word kilograms or the kilograms abbreviation with its kg period. One particular reason for this is the strength of certain medications prescribed can be determined by a person's height and weight. And though your loved one's height and weight will be taken in the hospital, this can give the emergency department doctors and hospital pharmacists an idea of what prior medications were based off of. Another reason that when I did home health on the side, and I would go out to see clients and there would be an elderly couple living together, by having their picture and gender listed on the front of the envelope, that could prevent paramedics and fire rescue, accidentally mind you, from picking up the wrong envelope. A third reason is that when they're in the emergency department, and if the envelope is put aside, the medical staff can recognize that this envelope belongs to your loved one. Lastly, names can be interchangeable. A woman could be named Michael, a man could be named Kim. So again, this can help identify that this envelope is theirs. Under this now, starting along the left side of the envelope, you're going to write date of birth followed by a colon. You'll want to make sure to spell out the whole month, followed by the 2-digit day and 4-digit year. The date across can be placed along the line where you started their name, or a little further back to the left of that, is because once you start to have everything you want to be placed on the envelope, is to then line it straight down, matching it vertically so it will be easier to read. At this point, we're going to take a short break, so please stay tuned to the next part, and thank you for watching.